From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And welcome to Medical Forum, sponsored by At Your Service Home Care. I'm your host, Jeff Reed, with Chris Marr, my co-host. Chris, how are we doing today?
Good, Jeff. How you doing?
Good.
Did you have a good weekend?
I did.
Good.
I did. Well, it's starting. So
That's
far,
right.
so
Starting
good.
our
Friday
new,
night
new
was great.
weekend.
That's right. Want to touch a little bit on our last show. I know that both of us got a lot of feedback. We tried to get in as many questions as we could, but I think we got a lot of knowledge out there, and I think that that's a great thing that our show's looking at doing, which is to kind of touch on some of these questions, but then also to bring in experts in the respective fields that some of these questions were directed to.
Absolutely, Jeff. A lot of great questions that we covered last week, and a few follow-ups on that since then. A lot of questions, people wanting to know how we can get some more information on some of the things we covered.
Yeah.
We covered those pretty quickly and talked pretty quickly about things like long-term care insurance. Talked about who's paying for coverage for these different services. Talked about wills and trusts and a lot of the legal aspects that you and I have just a very superficial understanding of. And so I think part of this is we're going to bring the experts on in the future. We're going to bring those the legal experts on who can tell us about how to get those wills and trusts set up, how to get the power of attorneys, the durable medical power of attorneys, the differences, what people need to think about with their family members and getting themselves set up.
Yeah, I think so. I know in our first few shows, for those listeners out there who have caught them, we've talked about hospice. We've brought in Colonial Family Practice to talk about all the things that they can do, from a neurology, CPAPs, and I know that's going to be something that we're going to talk about, which affects so many people with sleep apnea. We had Reliable Medical in here explaining some of the things on oxygen and CPAP as well as prosthetics. So that kind of brings us to one of the questions that was brought up last week, and we were talking about the differences between taking what like At Your Service Home Care does, which is being at the home, being sitting with someone and taking care of our elder, helping them with light housekeeping and such like that, to where does hospice start? And one of the topics was home health. So I think without further ado, to get into the home health, Chris, why don't you introduce our guest today, and we'll get some background and name of the company, and then we'll talk home health today.
Absolutely. Our guest on the show today is Cliff Dodson with Tri-County Home Health, corporation of MSA. MSA was a large corporation that has a couple of services in Sumter, including Tri-County Hospice, DME Company. And so we'd like to welcome Cliff to the show today.
Hey, Cliff, thanks for coming in on this bright and early Saturday morning, huh?
Thank you very much for having me. Hope y'all are doing well today.
We are. Hey, give us a little background. Chris touched on a little bit, but give us your name, your background. How long have you been with Tri-County? Tell us about Tri-County, and just our viewing area, just to refresh, is Florence, Manning, and obviously Sumter in the Lee County area. So, Cliff?
Yeah, well, Tri-County Home Health has been here in Sumter for over 30 years as a local company, serving the greater Sumter community. We are actually located at 2560 Tahoe Drive in Sumter, South Carolina, which is right off of Wilson Hall Road. And Tri-County is like Chris mentioned, a division of MSA, Medical Services of America, which is more or less a total home health care company. And what I mean by that is we have a home health company, we have an infusion company, we have our own pharmacy, a hospice division. We also have a DME and a personal response system. So we we're kind of the one-stop shop in healthcare.
Which is nice, and we had talked about this with your other venture, Jeff, at Reliable.
Yes.
Having so many different services under one roof, that really has a dramatic effect on patient care, I believe.
And just to touch on Cliff, on one of that I know the most Medi Home Service Care. We overlap a little bit with Reliable Medical Equipment. We do some things such as prosthetics and orthotics, something that you guys don't do, and you do the infusion and some of the other services. But you guys have been a fantastic ally. So whether you go to a place like Reliable Medical or Medi Home, I think you're getting outstanding care. And we always try to emphasize, stay local. We have tremendous physicians here. We have tremendous hospices. We're going to learn more about your home health today. But for the 15 years I've been in business, it doesn't get any better. I think that there's 3 or 4 that stand out, that do an outstanding job, and you guys are certainly one of them, Cliff.
Well, we appreciate that, and I'm glad you said the local. We've grown tremendously over the years, and MSA is a large company, but we are corporately owned by 2 individuals, own us in Lexington, South Carolina, and we have stayed true to that local feel. So I think that's very important to us.
Well, let's do this. Home health. We've had, as we mentioned, hospice on before, and we've had At Your Service Home Care and to talk about what they do. Let's talk about home health. If you can, maybe define for anyone who may have a person that's in the hospital now where the word home health is being bantered around. What is home health? And what separates it from a hospice? And I know that might be a 2-part question that leads us into our second break. But if we can handle the first part, if you had to describe home health, what is that, Cliff?
Well, home health has a couple of different aspects to it, actually several of them. And what we try to do is manage those aspects to our patients' needs. Just to kind of get into the aspects of home health, this includes skilled nursing, physical therapy, occupational therapy. It also includes speech therapy, medical social work. You also have home health aides, and there are certain underlying things under some of these main focus areas of home health.
Right.
And what I mean by that is, with your nursing, you have wound care, diabetic teaching. You have some underlying things like you have geriatric case management and medication administration. And then we also have different programs that we try to tailor to our patients to give them a little bit more of that acute care in the home so that we can keep them home and keep them from having to go back to the emergency room or go back to the hospital. We want to keep them out of the hospital is our number one goal.
So I think what you're saying is home health, it's very difficult to answer in one sentence.
Right.
We do so many things with home health. So if I'm a patient that has that needs wound assistance, if I'm a patient that needs diabetic assistance, if I am a patient, we deal a lot with prosthetic limbs. And I know that part of the process for us is using a company like yourself to help heal the wound. Then we need the occupational therapist to help them get in and out of the bed. And then we use the physical therapist to help them re-walk. So as we come up on our first break, Cliff, we'll come back with Medi Home Care, Tri-County, the whole gambit. And we appreciate your time. And we'll be back after we hit this first break.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Owning a firearm is both a right and responsibility, and keeping your firearms out of the hands of criminals is a special concern. Last year, 38 guns were stolen from cars and homes in the city of Sumter. This is Joey Duggan reminding you to do your part as responsible gun owners. Help keep firearms out of the hands of criminals. Locking your vehicles in storage compartments if leaving a gun in your car, never leaving firearms in your vehicle overnight, and storing all firearms securely in your home. For additional information on firearm safety, contact the Sumter Police Department's Crime Prevention Unit at 436-2723.
As a referee, I pay attention for a living.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.
If you see something, say something is used with permission by the New York Metropolitan Transportation Authority.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum, sponsored by At Your Service Home Care, located on 1250 Wilson Hall Road, Sumter, South Carolina, 29150. Our phone number there is 803-607-9677. We're here today with Cliff Dodson. And we are talking about home care this week. We had just started talking about some services that home care provides, and I think in this segment we're going to talk a little bit about the specifics of home care, meaning services that can be provided at home, including physical therapy, nursing, social work, occupational therapy, and try to get into the specifics of what each of them does.
Hey, Chris, I think, sometimes we take for granted, and I've had a couple remarks, we're in the medical field and we see this. And I think if we can, Cliff, when people are listening in, more specifically talking about home health, if we can, like you mentioned, dissect these down and kind of give a clarification of when we talk about wound therapy, and you can use sometimes a patient that comes to mind. Obviously, we won't mention the patient. But what is wound therapy, and where does home health play its role in wound therapy?
Well, wound therapy could have a couple of different aspects to it. First, trying to figure out the underlying cause of the wound initially, and then having a nurse, when they're called in to treat that wound, come into the home and help teach the family on dressing changes and get them more familiar with the aspects of taking care of that wound to improve that wound, so that to stabilize and improve the quality of life there. That's why it's nice to have a company like MediHome under our umbrella, that if they needed a product like a wound vac,
right?
Which is
what is a wound vac?
Well, a wound vac is to simplify it, is a piece of equipment that is put on the wound with dressings and actually pulls the moisture, the fluid out of the wound, without getting too clinical here. But
and the wound vacs, generally speaking, have shown to decrease healing time. Shorten the duration of the wound time.
Right, it increases the healing of the wound, and speeds up the healing process.
Well, when you mention wound, let's talk about, because something that's going to come up, and we'll talk about it. Does insurance cover this? Number one, and how long? So when you talked about the nurse coming into the facility and then helping train maybe the caregiver or the spouse or what have you, there is a limitation where you, from my understanding, from what we've dealt with, where your service can start and then it has to kind of wean itself off, for lack of a better word. And I think when we had Kim on, I think in the first show, she'd mentioned about home health with, I think, 2 to 3 days a week, and it's important in those other days then for the caregiver then to be able to step in and make that wound change.
Well, Medicare. We'll start with Medicare, and then
okay.
We also have your private insurances. Medicare, and this is under the home health umbrella. Medicare will pay 100% for home health services. Now they will pay as long as the patient is making progress and they require a skilled nurse, meaning they have a skilled need. That there's a need for them to have that nurse seeing them, and or therapists. They also must meet certain criteria for Medicare to get these coverages under Medicare. They have to be homebound. That's one of the main criteria for your home health services. Medicare does require patients to be homebound, and this means that they are homebound to the point where they would need assistance or somebody to drive them, unless it's some special circumstance.
And Cliff, and I apologize because I think I got us off on the subject because I do want it to go in to the next segment and talk about Medicare because that's something that people want to know and insurance. But on wound care, when you say home health, we're going to talk about physical therapy and occupational therapy and such. I guess I would fall into all that too. Medicare will cover under the criterion that we'll talk about maybe in the third segment in depth because that's something that we always hear. So going back, services, wound care, gotcha. Physical therapy. When people hear physical therapy, what does that encompass?
Well, physical therapy could encompass a lot of things. Typically one thing we see a lot of is with our hip and knee programs. We see a lot of hip and knee surgeries these days. A lot of people coming out of the hospital who've had their hip or knee or shoulder done. So we tailor our program specifically for these orthopedic surgeries and to improve their well-being after they've had, and this entails the physical therapy aspect of it. Now they don't have to have had surgery. Physical therapy could be to get better mobility, balance and steady issues. So it really encompasses a lot of things, but again, they're always goal-driven therapy.
Gotcha.
Is the meaning behind the physical therapy to keep those patients improving steadily and keep them out of the hospital and keep them from going back into the hospital for these.
Yeah, Cliff, that's a great example of where physical therapy is so beneficial. Post-operative for hip and knee replacements, for instance. These patients have just gotten out of the hospital. Getting to and from the hospital can be very difficult. It can cause a significant amount of pain. And so to really minimize pain, suffering, home health can come in and provide these services.
Well, and to touch on when we've talked about this, especially surrounding hips, we don't want to fall again. So we've been through a traumatic episode. And I think that's where an occupational therapist, another service that you offer, comes in and tries to steady them to where when they're doing something simple as going to the bathroom or getting from bed to the kitchen. And what's the role of an occupational therapist as we come in here in the last minute here on this segment? If you can sum up, what's an occupational therapy?
Well, just like you mentioned, the daily aspects of life is maybe as simple as tying your shoes or getting in and out of the bed, and they work right alongside with the physical therapist. Most of the patients that we see, not all, but a lot of them will have physical therapy and occupational therapy at the same time.
Right.
Whether they've had a hip or knee or anything done, or if they're just needing the therapy to get their goals. To maintain their goals. And so an occupational therapist would come in and help them with their daily aspects of life, whether it's getting in and out of the bed, daily walking, those type of things with the physical therapist.
That's great. And as we come up here on our break, and Cliff, we appreciate you coming in to see us, and from wound care to physical therapy to occupational therapy and more. Tri-County Home Health is your one-stop service. So we'll be coming back with Cliff and Chris, and we'll be back right after this message.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment. For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum, brought to you today by At Your Service Home Care, located 1250 Wilson Hall Road. Number over there is 607-9677. And a little plug for our program coming up next week. We're going to have Nancy Hunter Blanding with Colonial Aesthetics, and she's going to talk to us about some of the different aesthetics programs that they have over there, laser, the cool sculpting, Botox, and we'll get a little bit more information on what they do over there. Today, though, we're talking with Cliff Dotson about home health. And home health is so important, keeping people in their homes, especially in the wintertime. We get these cold winters in Sumter, South Carolina, with all the snow and ice, and people needing to stay on their staying inside. But realistically, though, home health is such an important role in the medical profession and delivery of medical care in Sumter. And we have several great companies who provide home health care, and Cliff specifically today is with Tri-County. And again, we've talked about wound care, we've talked about physical therapy, we've talked about occupational therapy, and I think I want to talk a little bit about nursing and in-home nursing care. And I'm just going to kind of throw it out there. In my practice, in-home nursing care is exceedingly important. Patients with new diagnoses of diabetes who may need a nurse to come out to the home and really educate patients about diabetic care in their home. It's not the doctor's office. It's not the facility, the sterile field, the doctor's office. It's in their home. It's talking to them about how to check their blood sugars, what to do, making sure that the phones readily available, they can contact someone if they have low blood sugars. Wound care, nurses coming out and doing the wound care in the home, really making sure that the home is an environment conducive to these dressing changes. Chronic disease management, COPD patients, chronic obstructive pulmonary diseases, patients with chronic respiratory problems who need treatment with nebulizers, using their medications at home. The nurses can instruct them on the use of these in their home, making sure that their oxygen is readily available to them. They have enough length on their oxygen cord, for example.
Yes.
Heart failure, tremendous disease in the United States. The readmission rate back to the hospital after a patient's discharged is very high with heart failure patients. The nurses from Tri-County are out in the home. They're making sure that the diets are adhered to. One of the most important things are daily weights, for instance, and monitoring the patient's weight on a day-to-day basis. Just the weight alone can be an indicator that the patient is going back into their heart failure state. And oftentimes things can be averted. But Cliff, tell me a little bit about the nursing staff you have over there and what they do.
Well, we have some great nurses, and they play such a vital role in all the aspects of our patients' lives. Whether it's literally just checking on them, communicating with them, checking their vitals, doing dressing changes, or doing any some type of education with other caregivers that they have in the house, doing blood draws with someone who's had their hip or knee done. They have to have their INR levels and everything checked. We've identified some of the major diagnoses, like Dr. Marr just mentioned, CHF, COPD, cardiac care programs, and we've tailored certain programs for these patients, and we actually have kits that go out with our nurses that help these patients kind of focus in on their disease. And it's something as simple as checking their weight every day. The nurses want to keep them on their protocols with this, so that they just get used to doing it, and it improves their life and keeps them out of that hospital.
One thing, Cliff, with our business with Reliable Medical, they're also the ears and the eyes. So Absolutely. A lot of times a patient gets discharged from the hospital, and once they get home back to reality, there's other equipment they need. So they're a great liaison, a great go-between, to where they may come out there and recognize something that also the patient needs, and they're very quick to get on the phone, and they take a very assertive action, which I think is a tremendous asset of your company. They are the boots on the ground, they're the eyes in the sky, and just do a tremendous job of recognizing where someone that maybe goes home and their levels fall off. And I know you see that a lot, Chris, in your business.
I think it's a great point, Jeff. As physicians, we really depend on these nurses who are going into the homes, and we're depending on their expertise. We're depending on their abilities to determine variations or changes in the patient's status. The nurses at Tri-County Home Health are fantastic. I have regular correspondences with them on a weekly basis regarding patients, and I trust them. I trust them to go out, to be the eyes and ears in the patient's home, and to relay that information back, and so that we can come up with a good treatment protocol for patients.
Well, that's one of the things that we're going to talk about in the next segment, Cliff. A little segue from Dr. Marr. How do we work with the physician? So if we could maybe talk us through, and we'll maybe get a little bit of it covered, and then we'll come back in the next segment. We've got about a minute and a half left. But when you talk about the communication with the nurse, and you talk about getting the information, as we talked about, insurance will cover it. But there are steps involved to where we can put this game plan in action. So let's talk through a patient that sees Dr. Marr. What happens from him to you to the nurse to the care that takes place?
Well, what we like to do, and I'll just mention real quickly with the nurses again, just that they are on the front lines with that, and keeping those patients compliant is a huge thing, because let's be honest, sometimes we don't always do what we say we're going to do, but that's a huge thing, is keeping these patients compliant. But to go along with our next segment here, what we like to do is work with our physicians and develop a patient's plan of care by having the nurse go out initially and do an evaluation with that patient. What that does, it gives them a feel of what's going on in the home, what's going on with the patient's current status, what's going on with the medical history of that patient, so that they can get a good initial feel to see which way do we need to go with this patient, because we don't like to cookie cutter any of the patients. Every patient is different. So we like to come up with a unique plan for that.
Well, Cliff, I'm going to interrupt you on that, because I think that's going to be our vital intro to our next segment. So as we come up on the station break again, want to thank our sponsor, At Your Service Home Care. Want to thank Tri-County, and Cliff, you coming in to visit with us on this early Saturday, and we will be back right
on
after
Medical
this.
Forum, presented by At Your Service Home Care.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back, getting ready for our fourth segment here at Medical Forum, sponsored by At Your Service Home Care, located on 1250 Wilson Hall Road. Phone number 803-607-9677. We have Cliff Dodson here today from Tri-County. And Cliff, before we go into that segment, give us a little plug here. Where are we located? Who do we service? Phone number, location? How do we get a hold of you, Cliff?
Well, we are here locally, Tri-County Home Health at 2560 Tahoe Drive. That's Sumter, South Carolina, right off of Wilson Hall Road. Local telephone number is 803-905-3510.
Thank you. And I do want to remind all the listeners out here on Saturday morning that this will also be replayed 2 to 3 on Sunday. In the segment that we left last, I think, Dr. Marr, this is with you and Cliff working together. It's talking about how does a physician like yourself intertwine or at least communicate to where if I am the patient or a patient of mine is being taken care of? How do you guys communicate? How do we set that plan of action? And Cliff, you had started in the last segment. If you'll kind of briefly follow up with that and then add on to it during this segment, please.
Okay. Well, what we like to do is work with our physicians and develop a patient's plan of care by having the nurse and or therapist go out and do an initial evaluation. This gives them a feeling and an idea of what's initially going on in the home, getting to know the caregivers, and seeing what's going on with the patient. But when they're doing that, they're going to observe the current status of the patient. They'll also get the medical history on the patient and then communicate the findings to the doctor on the current diagnosis and get the medical history from the doctor to give them that plan of care that they need.
Patients are identified in a multitude of arenas, right, Cliff? You know,
right.
Some of the patients are coming out of the hospital, and the discharging physician obviously may feel that the patient will benefit from home health services for a number of weeks to achieve a goal. That's the real important thing with home health is typically home health is driven by goals, goal-oriented patient care. And so the initial screening done by the nurse or physical therapist or occupational therapist sets some groundwork, sets some goals for the patient to accomplish over their period while on home health. So, for instance, that orthopedic surgeon who has just finished repairing the hip, who requests a company like Tri-County to come in and give some therapy for 2 to 4 to 8 weeks. It could be a physician in their office who identifies a patient who has limited abilities to get to and from the office every day. And that patient who has a wound, it's tough for them to get in to see me every day. They can't come in. My nurses cannot take care of those wounds every day. It is too taxing for the patient to come into the office every day. And so it's that nurse that comes out to the home on a regular basis to dress those wounds, to debride those wounds, to determine if any therapy needs to change, to determine sometimes if the patient may need to go back into the hospital or get into the physician's office, the surgeon's office, something to that effect.
That's right. And based on their current diagnosis, we want to come up with the physician with an agreed schedule to not only treat the patient, but educate the patient and the caregivers regarding their disease process and certain ways to stabilize them in the home because they're not able to see you every day. Our goal, again, is to keep them in the home where they're comfortable and prevent them from having to go back to the emergency room and prevent those rehospitalizations.
That's huge, Cliff. If anyone who works with a hospital who's listening to this program, readmission. I mean, that is such a buzz term right now. Right. And, there's a lot of penalties for readmissions now, a lot of penalties for hospitals, and anything that can be done to prevent those readmissions for heart failure patients, COPD patients, patients who are using emergency rooms and hospitals on a frequent basis. Home health is oftentimes one of the critical services to prevent those readmissions.
Absolutely. I sit on a committee for that very problem that you speak of, and that is a tremendous cost. People also to the hospital, obviously, but it's also to the patient. So if I'm a Medicare only, I get a 20% copay, or I have a deductible if I'm, they might be $2,000. So as I get readmitted back in, this is a lengthy, expensive avenue for the patient as well. And while we're talking about the hospitals, and I know that I'm preaching to the choir with you, Chris, on this, paperwork is probably tenfold.
I don't think we do enough of it, Jeff.
You don't think?
I don't think we do enough paperwork. I'd love to do another 2 hours of paperwork a day.
Well, and when you go in, all right, now if I go to the hospital, and let's just say that I've seen Dr. Ford is as fine a physician as you'll have to do a knee replacement or a hip replacement. And now I'm admitted in the hospital, and I see a hospitalist at Toomey Hospital, and you're my primary physician. Can Dr. Ford be the hospitalist, C, Dr. Chris Marr, who is my primary physician? Cliff, who writes all these notes that help me to have my insurance cover this for the people out there? Can it be all three, one or the other? Do we have to gather from all three? Does there have to be a communication, a gather of information? Either one of you on that.
Well, typically, in the hospital, the hospitalist can write their initial orders when they're getting discharged from the hospital. The best way to keep everything going smoothly is for them to have a primary physician to follow their progress through their home health. Now, if Dr. Ford or they've had their hip or knee done, then certainly if they're just getting physical therapy for that, then we'd have their orthopedic surgeon follow them with their physical therapy. But usually
it's COPD. Let's just say something that's going to continue on after, let's say congestive heart failure.
We would want their primary caregiver to follow them, and what I mean by follow them is just regular check them, looking at their orders, following their progress, having follow-up appointments with them, because their primary physician is going to be the one who knows them, who's seen them the most, and knows what kind of care they're giving and what kind of care that they need to improve them. That primary physician is always the best one to follow their progress.
And Dr. Marr, I'm sure you echo that. I mean, that's what, as that patient of yours goes into the hospital, a lot of people don't realize it until it happens, but you don't follow them when they go in the hospital. That becomes the doctors at using Toomey Hospital or Clarendon or McLeod, and then they come back to you and you get the notes in from the hospital. How does that work?
Yeah, absolutely. There's a great relationship that, for instance, Colonial Family Practice has with Toomey Hospital, whereby there's excellent communication between the hospitalists, the primary care doctors, whether it's over the phone or whether it's via hospital note.
Great. Well, as we come up on our last segment, again, Cliff, thank you for coming in this early, and we'll be back with our last segment
with the
of
latest
Medical
in health
Forum.
and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
I was visiting my elderly aunt, and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
This is Medical Forum, presented by At Your Service Home Care.
And welcome back to Medical Forum, brought to you by At Your Service Home Care, located on 1250 Wilson Hall Road. The phone number is 803-607-9677. And we are back today with Cliff Dotson talking about home health and how absolutely crucial home health is into the care of patients for a multitude of illnesses, multitude of problems. Sometimes actually just keeping patients healthy, home care is often sought out, keeping patients out of the hospital. We've talked about some of the services that home health provides, including physical therapy, occupational therapy, nursing, social work. Maybe that's one area that we haven't really talked a little bit about. Most home health agencies do have social workers on staff. Social workers can provide some care, including psychiatric care, for instance. Some social workers have training in treating patients with psychiatric illness to the point where it's debilitating. Patients have trouble leaving their homes, making sure that their medications are being taken correctly, taken on time, making sure that patients don't run out of their medications. But again, Cliff is with MSA and Tri-County Home Health. Cliff, tell me a little bit about the more personal aspects about Tri-County, some of the employees that you have working over there.
Well, Tri-County has been here in Sumter for over 30 years. We have been recognized in the item by the readers of the item in the past as the best home health agency in Sumter. We have some great staff. One of our therapists, physical therapist, Bob, has been with us for, I think, almost 20 years. Great asset.
Yeah, I know Bob. My patients tell me about Bob. It's really a nice thing. It's a true compliment to a provider when a patient will come back and comment specifically on caregivers. I know patients or patients' family come in and give me a compliment. That's a tremendous
means a lot, doesn't it?
Tremendous compliment. And but I have had patients come back and they tell me about Bob and the families that he's had an impact. He's really made an impact on patients' lives.
Yeah, I think that goes a long way, and it's nice on my end as well to be able to take that out in the field and talk with physicians and talk with patients about that. And one of our nurses, Stephanie, she is really, really good. I see her hustling around and checking on everybody, and just it's people like that really keep us going. And at the end of the day, it's all about patient care. It's about keeping these patients healthy, keeping them out of the hospital, and taking care of them in their home where they're more comfortable, and really caring about the people that they're seeing.
I think it's a great point. I mean, we're going through some trying times, not just in Sumter, but the whole medical industry is. Cutbacks, changes of insurance. I mean, anyone who has had insurance in the last 10 years can talk about it's the skyrocketing cost and such, and the cutbacks that unfortunately companies like myself, Cliff, yours, doctors' offices, and everything else. But when it really comes down to it, whether you've worked there 1 year or 10 years, it's going to come down to how you take care of the patient. And I know with your company, when we deal, whether it's a nurse calling or someone like Bob looking after a prosthetic patient of ours or such, the service stays the same. And although we go through a lot of trials and tribulations, and maybe not unlike any other business, it's just our time to go through some of these changes. And we see with the baby boomers getting older, and 10,000 people turn 65 every day. So we've got more people, and through medications and some of the things like Dr. Louder talked about with some of the equipment that's out there, we're extending lives. And in turn, that puts more patients on companies like yours, Cliff. And then now we got to figure out how to pay for it. and again, I wanted to, as we're in our last segment, because one of the questions we're always asked, whether it's hospice or it's a sitting service like what Chris and I do it At Your Home service, or it's medical equipment like Reliable Medical and such. Your services are covered by insurance. I know that there's a time when it stops and starts and requalifying, and that's all your services, right, Cliff, from physical therapy to occupational therapy to nursing, as we've talked about, correct?
Absolutely. And, Medicare is changing every day. There's been so many changes in the Medicare business as a whole. But with home health, Medicare will pay 100% for those services as long as the patient is continuing to make progress and has that skilled need, meaning requires that skilled nurse and or therapist to improve their well-being. And again, they need to meet that homebound status. That's a huge criteria under home health. They do need to be homebound. Now they are still able to. There are a few exclusions in that. They can go to church on Sunday, and with assistance from somebody can drive them to the store. So it's not like they have to just be, that there are a few exclusions to that.
And your social workers help get to the bottom of it. There's a questionnaire, there's an interview process, as you mentioned. A lot of people, I think, if I'm understanding what you're saying, may say, well, I'd rather just be at my home. But they drive and they physically can do things, and unfortunately you have to be, I guess, the bearer of bad news to tell them, I'm sorry, but the service of us coming out here cannot be available, which I kind of, in a way, is a good news because you're able to maneuver yourself and get yourself from A to B.
And we just have so many options available, though, for them. We have social workers that help assist them with daily things. We have a resource links program that helps assist them in things as long as finding them a church to go to or finding local things for them to do. We also have with our personal response system, our help unit, our call center up in Seneca. We have a little lady that she hits her little button on her call pendant just to talk to people up in Seneca, South Carolina, just to tell them good night and everything, just for that personal
very
feel.
nice.
She just wants to have somebody to communicate with. So
Very
it's
nice.
all the little things that add up to total home health care, and that's what we strive to be.
Well, Cliff, as we wrap up today, we really appreciate you coming in. Really like to thank Tri-County Home Health for all the services they provide to the Sumter community, and do a
give us one more time, Cliff. Give us that contact number and your physical address.
Okay, it's Tri-County Home Health. We're located at 2560 Tahoe Drive, Sumter, South Carolina, which is right off of Wilson Hall Road. Local telephone number 803-905-3510.
And we'll be back next week with Medical Forum. Again, Nancy Hunter Blanding from Colonial Aesthetics. Talk to us next week.
All right, everybody, have a great weekend.
Have a good weekend.
Thank you.